Hi everyone, my name is Georgia Greenblum, and today I want to talk with you about why we, as a global community, need to be addressing the high prevalence of anemia. Anemia is a condition in which the number of red blood cells or hemoglobin concentration within them is lower than normal. Hemoglobin is necessary to carry oxygen throughout the body. If you don't have enough hemoglobin, the body's tissues will be depleted, resulting in symptoms such as fatigue, weakness, dizziness, and shortness of breath. While anemia can result from nutritional deficiencies such as iron or vitamin B12, infectious diseases such as malaria, HIV, and others can also lead to anemia. Previous studies have primarily concentrated on anemia in young people. In 2016, the World Health Organization estimated 42% of children less than 5 years of age and 40% of pregnant women worldwide were anemic. However, little research has been conducted into the prevalence of anemia in older adults. Today, I'm going to be talking to you about collaborative research I'm doing with anthropologists Alicia DeLuise and Dr. Josh Snodgrass that investigates the relationship between anemia and socioeconomic status in adults older than 50. This research was done in conjunction with scientists from the World Health Organization as part of their study on global aging and adult health, known as SAGE. SAGE is a longitudinal study of determinants of aging in 6 middle-income countries, including China, Mexico, Russia, Ghana, South Africa, and India. For this study, biomarkers were collected on a subset of 14,848 adults 50 years and older in China, Mexico, and South Africa during the first wave of SAGE, which was conducted between 2007 and 2010. Participants in each of these countries filled out questionnaires related to education, self-rated health, income, marriage, smoking, gender, and their geographic location. Further, minimally invasive medical tests and exams, such as finger pricks in order to retrieve hemoglobin levels, were conducted. With mounds of data from thousands of individuals, I used R to clean the data and accounted for skewness and kurtosis. I then completed analysis on the data, doing a binary logistic regression and extracting odds ratios predicting anemia. Anemia cutoffs were classified based on hemoglobin levels based on gender, as generated in a 2011 World Health Organization study. The results were striking. Anemia rates in adults older than 50 were found to be 28%, 24%, and 91% for China, Mexico, and South Africa, respectively. The World Health Organization defines these rates as moderate to high public health significance. This discrepancy could be explained by the general unhealthy status of older adults in South Africa, found in similar analysis, cited in biomarkers such as HbA1c, measuring blood sugar levels, C-reactive protein, a nonspecific indicator of inflammation, obesity, and the like. Additionally, South Africa has the biggest HIV epidemic in the world, with over 7 million people living with HIV. And because of the impact of disease and virus on hemoglobin levels in the body, this could be a reason for the drastic difference in prevalence. Further, because the SAGE study was nationally representative, this decreased the bias in anemia rates previously reported in South Africa due to their limited and undiversified participants. Significant variables predicting anemia rates differ for each country. We concluded that lower wealth predicted higher anemia in all countries. However, education predicted anemia only in China. In South Africa, only income was a significant variable. On the other hand, income and age were both significant to predict anemia rates in Mexico. Because results are independent, there is a suppression effect with socioeconomic status because income and education were both assessed variables. This being said, because both education and income were deemed significant, this shows just how strong socioeconomic status has on predicting anemia with different measures to demonstrate. This study highlights how the prevalence of anemia in all 3 countries was higher than anticipated and represents a substantial public health burden. Additionally, this study illustrates the particular health risk for anemia in older adults, particularly in South Africa. Support for SAGE was provided for by the U.S. National Institute on Aging through interagency agreements and research grants. This study would not have been possible without compliance from participants, SAGE staff, Paul Kowal, Nimala Naidu, and Somnath Chatterjee. Thank you for your time.